telemedicine helps me on emergencies. Since going to telemedicine, I've actually gotten rid of my emergency cell phone, and I no longer have the anxiety of not knowing who's calling. Now that I use actually telemedicine or AirVet, I actually see who the client is, what pet they're talking about, and they give me some kind of broad description of the issue. That way, when I actually accept the call, I have some direction of where we're going. Am I going to have that client come to the clinic? Or is this really not an emergency situation, but they need some advice and they're going to pay me for that phone call? So my time is also compensated and everything is a whole lot easier to deal with. AirVet actually comes already kind of set up for $30. We can actually adjust that amount. So if the phone call is 15 minutes, which I think $30 is pretty good, then I leave it alone. If this phone call goes on forever or our text conversation goes forever, actually I can increase that amount. I also can decrease the amount. So if a client calls me about a condition or a pet that I saw a few days ago, and they don't think that it's actually progressing in the right manner, I might actually comp that call and not charge them. But actually in our AirVet, the price is already set at $30. If the client was uncomfortable downloading the app or getting the request and setting up their account, my staff, when they're outside getting their pet, actually goes step by step with them. And in some cases, and some of our older generations, they actually take the phone and do everything for them. Usually those clients that are having issues with the app actually like it the most because they do not want to get out their car. They are very COVID aware. And so they're liking that kind of communication without putting themselves at risk, but they just need help getting set up. Instead of having somebody go back and forth outside every time I have a question because the client doesn't have any way to communicate with me, I now have, if they at least have their cell phone, there's direct communication. Sometimes over the phone, we forget to ask certain questions and then we'd either send out somebody else outside or I'd have to call back. This way, it's more of a constant conversation than actually having to stop what you're doing, find a landline, or get somebody to go inside or out, in and out of the clinic to answer questions. I actually got my team on board. I set them actually how many clients I wanted to get on AirVet within a month. And for a reward, I took them out to get some kind of spa treatment. And because there was a reward system and we had a goal, our staff, being the type of personalities they have, met and actually exceeded that goal. And once you have your staff on board, it is so easy to implement. Now, on the client side, there is a small population of our clients that do not actually have a smartphone. And that way, telemedicine right now is a little bit of a hurdle for them. But most telemedicine companies are actually starting to institute a desktop version. And these owners usually do have a home computer. So it will be easier on emergency and actually doing virtual visits once all telemedicine companies have both a desktop and an app version. As we see human medicine embracing telemedicine even stronger, especially during COVID, we need to make sure that we capture all that revenue, actually give our clients what they want, a stronger relationship and connectivity to us before they actually seek that kind of relationship elsewhere. Corporate medicine is already starting to embrace telemedicine, and as private practitioners in rural America, we need to make sure that we gain that acceptance and actually capture our clients and embrace that kind of relationship we have with our patients and our clients. Telemedicine is for any type of veterinarian, whether you are large animal only, a mixed practice in a big city, or in a very small rural town. It actually does help me have a more balanced life. I get to actually make these schedules on my time. So if a client calls me on emergency and they need to speak with me, but it's not something they need immediate care, I can actually look at that and decide and send them some type of reply that I will call you at this time. I can make this actually work on my schedule and help the client. And that kind of technology is priceless.